You're welcome to yet another episode of Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Authority, NHIA, to keep you abreast of its strides as it moves Nigeria towards attaining universal health coverage. My name is Aisha Muhammad Ahmed, your regular anchor. With the recent signing of the NHIA Act into law, it became necessary that players are enlightened about the changes that comes with it. In this episode of Easy Access to Healthcare for All, we bring you a brief interview with Prof Nasir Sambo, Director General NHIA, where he speaks on the new law and steps taken by the authority to keep stakeholders abreast. Please stay tuned as we bring you these details. Keep watching.
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
First on the program is a highlight of events around the NHIA. In the news, NHIA sensitizes HCF on Medicine Supply Initiative. Also on the lineup, NMA pays courtesy visits to NHIA.
Number one, sir.
In line with the provisions of the rebranding agenda of the leadership of the NHIA, management of the authority on 23rd June 2022 organized a one-day sensitization for healthcare facilities under the health insurance ecosystem. The essence of the meeting was to intimate them on its new medicine supply initiative and the parameters of its operations. The DJ, in his opening remarks, said the initiative has become necessary due to lingering issues of drugs in facilities. He also said the initiative was borrowed from the then Petroleum Trust Fund and hopes to do same with equipment.
One of the recurring issues that has been bedeviling the operations of the National Health Insurance Scheme then was the issue that has to do with availability, assets, affordability, as well as quality drug in the health insurance ecosystem. And then we resolved that we must work assiduously to ensure that that problem is resolved permanently. And after several discussions, we came into conclusion that we need to have a mechanism whereby drugs that are being consumed in the health insurance ecosystem should not only be branded, but should be made widely available to all healthcare facilities so that our TB enrollees can have access to those drugs. So we mooted the idea of having to rebrand the drug. And this rebranding will enable us to ensure that drugs are not only available, but they are affordable, because of the principle of the scale of quantity.
The meeting had a series of presentations that will keep stakeholders abreast on the initiative. Participants lauded the Medicine Supply Initiative.
This initiative is very good. The way I look at it, before we thought most of our health facilities, they became only a consulting ground, but we don't have the supply chain of medicine, good qualitative medicine. So we felt it's a very good initiative because we are going to assure the quality of the medicine that they are going to give us.
Well, it's a welcome development, and to an extent, I think it will help majorly the HCPs, which I represent, to achieve the NHIS objectives and goals. And this will go a long way also to the enrollees in order to curb this out-of-stock syndrome that most of the enrollees face at the HCP.
The management of the National Health Insurance Authority recently received a delegation from the National Medical Association, NMA. The team was led by Professor Innocent Uja. The immediate past president of NMA was on ground to present a report of a recent research carried out to assess quality of healthcare, challenges, and patient satisfaction with the Nigerian Health Insurance Authority. While speaking, Professor Uja explained some of the things put in place by the team.
We are recruited, and what we are here for today is to give a draft findings of what we have seen on the ground. And science is such that it is constant and it can be reproducible. Once you do a quality research, you expect that it's reproducible. So we are here to just give a summary of the findings of the National Health Insurance Scheme, and it again to partner with National Health Insurance Authority to improve the quality of care.
The research was conducted by NMA in collaboration with other researchers. After the presentation, the DG commended the team for their effort and also added inputs and suggestions that will help strengthen the structure of the research.
When we came to the National Health Insurance Scheme, we unfolded our 3-point rebranding agenda. The second one is engendering transparency and accountability. And I say, when we deconstructed them, one of the 6 key elements in the second one is ensuring that there is evidence in decision making. And the only way you can get evidence in decision making is what the NMA is doing now. I think this is a paradigm shift. And NMA must be commended for that. So in future, when we are talking, we are going to be talking with facts, not hearsay.
The program is easy access to healthcare for all. With the recent assent of the National Health Insurance Authority Act, quite a lot is being done to carry everyone along towards a seamless implementation of the provisions of the Act. We had a short interview with Professor Nasir Sambo, during which he explained how the Act will impact health insurance for Nigerians. The authority also, in keeping with recent trends, held a meeting with development partners on how to move the health insurance sector forward. Details of this shall come your way in our next segment. Keep watching.
With the assent to the new National Health Insurance Authority Bill that repeals the NHIA's Act, the need for the authority to enlighten not only its personnel but stakeholders as well as Nigerians is even more pertinent. This because, among other things, the law has strategically expanded the operations of the authority. Professor Nasir Sambo, who now wears the cap of the first Director General of the authority, speaks on the journey and how the new law will help the fulfillment of the agency's mandate.
If we are talking about universal health coverage, the veritable mechanism to attain universal health coverage is globally acclaimed that it is health insurance, social health insurance, because social health insurance has capacity to address all the issues that has to do with financial access to healthcare, because it has capacity to generate funds, it has capacity to pool funds, and it has capacity to ensure strategic purchasing of healthcare. So, and there is a very important element in that arrangement, whereby there is pooling of resources and risk together, so that people that are well and healthy can subsidize for the people that are ill. People that are rich can subsidize for people that are poor. So when you have a voluntary law, you have missed that very important element of social health insurance, which is cross-subsidization.
The DG explains what the amended law really means and some of its highlights.
The law will now be mandatory for every Nigerian and any legal resident in Nigeria. And within the law, in order for government to fulfill its own side of the bargain, a provision has been made for what is called voluntary, for what is called vulnerable group fund, which will, in which so many sources of funding has been outlined, and that will bring about huge resources that will be able to cover about 83 million downtrodden Nigeria, all in an attempt to attainment of universal health coverage. And when Mr. President was signing that law, he made a pledge that that vulnerable group fund will be populated through various means to ensure that 83 million poor Nigerians will have access to healthcare delivery services.
With the signing of this bill, more funds will be pooled, thereby giving a roadmap for the attainment of universal health coverage in Nigeria.
With the assent of this bill, the roadmap for attainment of universal health coverage has now been clearly defined. What we have been doing hitherto is just scratching the surface. It's to just talk without action, talking without action. You want to attain universal health coverage, you know that financial access is key, and you do not define a very clear mechanism of how to generate funds to cover the people that are uncovered. So it will just be mere rhetorics, but with the assent of this bill, it is walking the talk.
According to the DG, the new law brings quite a lot to the table in making health insurance worthwhile.
When people will have a very good healthcare services as we envisage with this bill, it therefore means that the quality of life will improve. It therefore means that the life expectancy will improve. It therefore also means that the socio-economic, because of their improvement in health, the productivity will improve. And once the productivity improves in a country, there's no gainsaying the fact that there is a tendency for the gross domestic product, GDP, will improve. Then the economy will improve.
Can we welcome her?
In carrying its partners along, the authority held a meeting on Tuesday, the 21st June 2022 with its development partners, who also are key stakeholders in the achievement of its mandate. The objectives of the meeting include deepening the understanding of the NHIA Act and to make a well-articulated roadmap that will fast-track its implementation, to review the Act, a comparison of the content of the NHIS Act and the NHIA Act, to appreciate the implications of the Act on the operations of the NHIA and its stakeholders, to align the new Act with strategic plan document, etc. To keep partners abreast with the new law, a presentation on highlights of the NHIA Act 2022, which entails a comparative analysis of the old and the new law alongside 28 dimensions, was delivered by Blessing Nienge.
You refer to Professor Nasir Sambo as the Director General. That is section 40 sub 1. The appointment of the DG now is to be confirmed by the Senate. Mandatory health insurance for every Nigerian and legal resident. This is to engender the USC we are clamoring for, or we have been dreaming. Section 3B and Section 14. The Act establishes states and FCT schemes, so that collaboration between states and us and all of you will be strengthened, all gearing towards USC.
The Director General NHIA, Professor Nasir Sambo, presented a paper on NHIA Act 2022, critical areas of modification and strategy for implementation.
The agencies at the national level and subnational level, they must bring out a clearly defined programs for all the strata of the population to be covered. Is that clear?
Other topics discussed were role of development partners in the implementation of the NHIA Act 2022, which were discussed along 4 thematic areas, namely governance, funding, financing, technology, operations, and cross-cutting issues. The sessions were quite interactive as they comprehensively dealt with the issues around the implementation of the new law.
Welcome back. For a better coordination of its activities, the National Health Insurance Scheme, now Authority, divides the country into various zones, one of which is the South-South Zone. This zone comprises of Edo State Office, Delta State Office, Bayelsa State Office, Rivers State Office, Akwa Ibom and Cross River State Offices. This geographical area has its peculiarities when it comes to healthcare delivery. In our Stakeholders Corner today, we had a chat with pharmacist Nuhu Adoji, Zonal Coordinator of the zone, who gives an assessment on healthcare delivery in the South-South Zone.
In the zone is reflective of what is happening in the country. And that is why we are there in the first place. That no matter how we think the health sector is faring, we are there to add value in terms of, from the point of view of NHIA, which is demand side, to ensure that we increase the coverage. By and large, I think our journey towards universal health coverage is inching forward. Because if you look at my zone, a lot of states health insurance program that we're even collaborating with are coming on board. And in addition to NHIS coverage, those ones also are covering more lives within their state. So in a nutshell, there has been improvement.
With the peculiarities in his zone, he says the zone is equipped to face the challenges when the need arises.
Indeed, there are peculiarities in my zone, because if you look at some states like Bayelsa, which is purely riverine, reaching those knock and crannies can be a bit difficult. But it's not unsurmountable. And to this end, I would like to thank the management, because each state is equipped to ensure that we deal decisively with the peculiar challenges that we face in those states, not to deter us from reaching those environments. We are reaching out to them whenever there are issues in terms of even quality of service. The state office is there to deal decisively, and that's why the management has recently recruited healthcare personnel to be able to deal with the issues as they come. Those who are knowledgeable to handle it, and that is ongoing. So as the challenges emerges, we're able to provide solutions to those challenges.
Pharmacist Nuhu said gift-ship program is enhancing coverage in his zone.
The game changer and the flagship program, I must say, is the gift-ship. And a lot of people are actually logging across the zone. So we are driving this very hard in terms of coverage, because especially for those who felt left out, those who are not civil servants, either public, at the federal level or state level. And even to some extent, those who are even civil servants at the state level, whose state health insurance program are not gain traction, they have liberty to log into national program, which is NHIS. And so we're driving that out and we're spreading the message across the states. That's why we're encouraged to organize a stakeholders forum to bring in people to enlighten the society about this program, give shifts, and so that people can leverage. Retirees, for example, can leverage on that. Those who are self-employed can leverage on that also, and so on and so forth.
Pharmacist Nuhu says continuous monitoring of both healthcare providers and health maintenance organizations is yielding results.
The HMOs have offices, and I think some of them are in the zone, particularly in Bini and Port Harcourt. So they are not in hard-to-reach areas, so it's very effective to monitor their activities, of course, based on policy guidelines from headquarters. And we do that. And where there are issues, we tell them to align to the operational guideline of NHIS. Yeah, and if there are serious issues, we refer to headquarters, and headquarters deal with it decisively. Our offices do what we call sporadic quality assurance visitation to hospital, unannounced, and we interface with our enrollees to know, how the service is being provided. And through that feedback, we're able to intervene and ensure that quality of care is adhered to according to NHI's operational guideline. And where it seems not to align, we also intervene, to see that the needful is done.
That was pharmacist Nuhu Ajodi speaking on health insurance in the South-South zone. Stay tuned for your questions answered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: can an enrollee access healthcare services outside his or her state?
We have a list of accredited healthcare facilities all over Nigeria, and you are entitled to, as a referral case, you could be referred from Abuja to access care outside Abuja. You could be referred to any hospital with the adequate skills, manpower, and equipment to treat you in any part of Nigeria. But again, at primary level of care, you are restricted to one facility. And that facility is what we call your primary healthcare provider. So you are registered with healthcare with that particular hospital or health center, and you are to go there to access care at the primary care. That hospital is capable of referring you, like I said earlier, to any other hospital.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
And so we draw the curtains on this week's episode of the program. We all have a responsibility in helping Nigeria attain universal health coverage by keying into the NHIA and letting more Nigerians know that they can enjoy social health insurance everywhere and anywhere they are across Nigeria. Find out how and get enrolled today. See you next week.